Now we are going to discuss about the alpha and beta blockers. So we already studied about that the receptors are of two types, that is adrenergic receptors and cholinergic receptors. So adrenergic receptors are again of two types, that is alpha and beta receptor. So alpha receptors are having their subtypes as alpha 1 and alpha 2, and beta receptors are having their subtype as beta 1, beta 2 and beta 3. So out of those, alpha 1 and beta 1 are showing contraction related mechanism, vasoconstriction related mechanism. So here we are studying the specific kind of drugs which are directly blocking the alpha 1 receptor as well as beta 1 receptor, and thereby they are reducing the vasoconstriction mechanism that is caused by those kind of agents, and thereby they are reducing or minimizing the hypertensive state associated with the patient. So particularly we are starting with the first category, that is alpha 1 receptor blocker. So whenever there is a release of catecholamine, it will come in the synaptic cleft, and then it will bind to the postsynaptic receptors. So here it can bind to alpha 1 receptor and produces its mechanism that is associated with the sympathetic tone activation. That may be so it can result to cause rise in blood volume, cardiac output, and blood pressure, also vasoconstriction. So if we are using alpha 1 receptor blocker, so these are the drugs which are directly blocking the alpha 1 receptor, so that whatever the synthesized catecholamine is there, it will not bind to the alpha 1 receptor, and if binding is prevented, then its uptake into the vascular muscle will also get prevented, and due to that vasoconstriction will not be there, and hereby it is resulting in production of vasodilatory mechanism. So it can result to cause reduction of blood pressure as well as reduction of peripheral vascular resistance also. So that is the basic mechanism which is associated with alpha 1 receptor blockers. So here are some adverse effects associated with the alpha 1 receptor blocker, that is they are showing the mechanism which is oriented towards sympathetic tone activation. So if we are utilizing all those drugs in excessive manner, or if the toxicities are associated with this drug, then they will produce the symptoms like those effects only. So the effects are transient dizziness, faintness, palpitation, even syncope, orthostatic dizziness, and sodium water retention. So as these drugs are showing their mechanism that is totally associated with the postsynaptic means postganglionic nerve fiber, so they are not having any kind of control that is associated with the sodium water retention, and due to that there may be rise in sodium water absorption, and it can means the it can get opposite effect that is associated with the patient. And that's why if we want to use the category of drugs for management of hypertension, then we have to administer other drugs that are showing their effect that is oriented towards sodium water retention property. Okay, so here is its mechanism that is oriented towards cellular level. So alpha 1 blockers, that means they are means inhibiting the phospholipase C, which is associated with the IP3 DAC pathway. This IP3 DAC pathway, that is the G protein coupled receptor pathway, which is resulting in production of the sympathetic tone. That means it can cause vasoconstriction, and due to that this if phospholipase C activation gets inhibited, so it will inhibit this IP3 DAC pathway, and due to that vasoconstriction will not be there, and it will produce vasodilation, and due to that again the afterload as well as preload gets reduced, and due to that there will be reduction in the blood pressure. Again, the alpha 1 antagonist or alpha blockers can directly inhibit the hypertrophic state associated with the heart. So hypertrophy means that is the increase in size of the muscle or cardiac layer. So it is reducing this mechanism also, or preventing the means production of hypertrophic state also. Now next, that is here examples of the drug are, that is ending with the means zosine, that is prazosin, doxazosine, terazosin, etc. So the particular drug, that is doxazosine, it is a unique category of drug which can be used for treatment of benign prostatic hyperplasia. So benign prostatic hyperplasia, it is a means disease state that is associated with the veins, and it is causing enlargement of prostate gland. So there may be problems associated with the urinary system also, and it is specially means utilized for treatment of this kind of condition. And if we want to use this for particular, that is hypertensive effect, so we have to use the drug in combination with another antihypertensive drugs. Now next category is there, that is beta blocker. So beta blockers are the rough category of drugs. So they are not particular or selective agent. So they can be non-selective as well as selective. Means if we want to get a specific cardiac effect, then we have to use selective agent. That means beta 1 selective agents we have to use. Otherwise, they can activate or stimulate beta they can directly block the beta 2 receptor also, or they can again block beta 3 receptors also. So we have to go for selectivity, otherwise they will produce some toxic effect associated with those particular receptors. So they are showing their mechanism by blocking this kind of beta receptor, and due to that there will be negative chronotropic and negative inotropic effect associated with the heart. So inotropic effect is associated with the force of contraction. Means if we are reducing the force of contraction, then the contractility associated with the heart get reduced, and the excessive stress on the heart will also get reduced. So there will be reduction of the blood pressure. And chronotropic effect means it is associated with the rate and rhythm of the conductance. So again, if we are minimizing the state, then again we can minimize the blood pressure associated with the patient. So chronotropic and inotropic effect can be of two types, that is positive and negative. If positive inotropic effect is there, then they will stimulate the heart, and if negative inotropic effect is there, that means they are reducing the activity of the heart. So beta blockers are showing their mechanism by negatively affecting or negatively showing the chronotropic and inotropic effects. Again, they can inhibit the release of renin. So in case of ACE inhibitor mechanism, we studied that renin is the showing its mechanism for the conversion of angiotensinogen to angiotensin 1, and further angiotensin 2 is synthesized, which is causing vasoconstriction and rise in blood pressure. So they are also playing role for inhibition of renin release. So if renin release gets inhibited, then sodium water retention also get inhibited, and due to that blood volume get reduced. So here beta blocker exam category of drugs include examples which are ending with the lol. So here are some examples like atenolol, betaxolol, bisoprolol, metoprolol, etc. So these are when we are administering all those drugs for cardio selective effect, so we have to administer all the drugs with low dose, and afterward we can increase the dose as per necessity. But if we are administering high doses, then the effect is lost, or they can stimulate other kind of receptors also. Then next parameter is there, that is some category of drugs are showing the intrinsic sympathetic activity or partial beta receptor agonistic activity. That means they are showing sympathetic tone associated with the beta blockade. So the effect gets neutralized, means from one side we are blocking the beta receptor and thereby producing relaxation, and here due to intrinsic sympathetic activity, they are raising the tone of contraction, and due to that effect gets neutralized and we are not getting any beneficiary outcomes. So we have to consider this point, and we have to remember the examples of drug, that is acebutolol, cartilol, then penbutalol and pindolol. So these are the drugs which are having intrinsic sympathetic activity. Then propranolol and metoprolol undergo first pass metabolism. So extensive first pass metabolism is there, that means their degradation rate is high, and due to that the dose adjustment is required, because the dose gets reduced means metabolic activities are more, and due to that drug is not effective to show its mechanism, means doses are getting reduced. So we have to consider this point also. Again, atenolol and nadolol, so they are having long half life and they are excreted renally. So if half life is more, that means drug is means living in body for longer duration of time. So if we are increasing the dose, then the drug gets saturated in the body and it can produce toxicity associated with the patient. So we have to assess this point also, and thereby we have to monitor and maintain the dose associated with this category of drug, otherwise it may produce some toxicities associated with the patient. Again, we have to minimize, or we have to reduce the dose of the drug in patient with renal insufficiency. Of course, renal problems are there, that means patient's organ is not functioning properly, and due to that we have to minimize the dose of the drugs. Then next, that is beta blockade in the myocardium. So it can cause some kind of abnormality. So we have to check all those parameters. Means if suppose beta blockade is there, then it can lead to cause further kind of illnesses. So we have to assess and check all those parameters also. Again, blockade of beta 2 receptor, it can cause, that is PAD, that means peripheral artery disease and Reynolds phenomenon. So due to means lack of supply or reduction in the supply, the extremities or the end points of our body gets means bluish in coloration, and due to that this kind of disease condition may develop. So again, we have to check all those parameters. Then we can't stop beta blockers means suddenly, because if we are doing so, so they can cause the cardiac conditions like unstable angina, MI, and it can produce fatality in the patient also. So we have to means taper the dose. If we want to stop the beta blocker therapy, then we have to taper it, and afterwards we can stop it. Again, in patients means again there are some side effects which are associated with the beta blockers, so we have to check all those parameters also. So they can produce tachycardia, sweating and other conditions also. Again, they can means show effect which is associated with the rise in serum triglyceride levels, and again they can reduce high density lipoprotein cholesterol levels also. But these effects are means as per studies, they are not having any kind of significant means results. So uh, we can just consider this point, so that they are having some kind of effect on triglyceride levels also, so it may lead to cause further complications in the patient.